First of all, huge welcome as always to this global webinar. We're very thankful that Mrs. Archana Kulkarni has very kindly agreed to present, and she'll tell you a little bit about her. It's always a fascinating subject for all of us, particularly for parents. So we'll try and capture and answer all the questions. Anything we can't answer, we try and find out and we put it on the website afterwards. And we can get back to you after the session with answers if there's something very particular that is an answer tonight. We turn your microphones to mute mainly, and if you can do that, if you haven't already, mainly to avoid any background noises such as crying children or more likely barking dogs. So that's just to ensure that people get the best sound possible. Today's session is in English, and if you do have a question later, if you can click on the mic button to unmute yourself. You can also type a question into the chat box and we can come to that, and I can help facilitate some of that. We aim to always record these sessions so that we can capture the information afterwards. My good colleague Catherine then edits it with a top tip so we can put it on the website. So if you don't want us to use any photographs, please just put your cameras off. We don't use many photographs, but it's just really to try and help those who can't join us tonight to be able to share some of that learning. We do try and follow up with a little bit of social media too. Okay, so those of you who are new to the webinar, my name's Anne Chivers. I work for ASUK as the kind of global executive director alongside my colleague Catherine Lewis, and we do these webinars every month on a range of topics, and we're always very, very thankful that we get lots of professionals and experts by experience joining us. The focus tonight, as I said, is all about the eyes. There's a couple of pictures of some of our youngsters there. Okay, so the next slide, please, Catherine. Okay, so I'll come back to this slide at the end. I'm just going to flick back one, and I'm going to pass you straight over to Mrs. Archana Kulkarni, who will introduce herself. I think she's still at the hospital. I'll go off screen. As I say, any questions, any IT problems, contact Catherine. So welcome, 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 and big thank you to Archana. It's over to you.
Lovely. Thank you very much. Thank you for having me over. It's always lovely to, exchange ideas, and I actually learn a lot from everybody else involved in the clinic. So if I just start the screen share. Okay, is that clear enough?
Yep, that's brilliant. Thank you.
That's lovely. So I work as part of the multidisciplinary team at the Birmingham Children's Hospital in the Alström's clinic, and I've been doing that since about 2014. And there's lots to learn. So lots to learn from parents and children's experiences, and we keep adding on to the information. There are also quite a few new developments which I'll talk about as well. So when we think about Alström syndrome, the first thing that comes to mind is the photophobia, or the sensitivity to bright light. And it's that glare that often just is quite disarming and disturbing to children and adults as well. There we go. Right. So what I'm aiming to do here is just to take you through why we get these eye problems. So how does Alström syndrome affect the eyes? What we can do to look after the health of the eyes, and all the supportive aids that are available, and what we can do to help maximize the vision we have, to manage the photophobia, and also use all the latest technology in order to assist in day-to-day life. Sorry, I think the slides are a little bit slow in terms of moving forwards. there we go. So just a quick overview of the eye here. So in terms of in Alström syndrome, what happens is the innermost layer, which is lining the back of the eye, the retina, is what gets affected, and mainly around the central part of the eye, what we call the macula. And the reason for that is because the cones are the ones that get affected the most. We now have the advantage of having the OCT, or the optical coherence tomography, which gives us a cross-section of this very thin layer of the retina at the back of the eye with the 10 layers. And what we see, what happens at Alström's is this outer layer, which involves the photoreceptors, mainly the outer segment of the photoreceptors is what gets affected. And as you're aware, Alström syndrome is part of one of the ciliopathies, which is basically a disorder of the cilia, which is that little area which connects the outer segment of the photoreceptor, the rods and the cones, to the inner segment. And this is the one which is the signal. It has the signaling effect, which tells the photoreceptors what proteins to make, what proteins to transport in order to convert the light into actual vision, or part of the phototransduction process. And the proteins is what is being affected. And that, because the proteins are not transported properly, what happens in this layer here, you can see how nice and smooth it is in the normal retina. The photoreceptors get disrupted, and then that leaves a little granular, clumpy appearance of fragmentation of these photoreceptors. And in Alström syndrome, that mainly affects the central part, or the macula of the eye, compared to the periphery, as in cases of other ciliopathies like Bardet-Biedl syndrome. So eventually, although the center is affected first, eventually the periphery also gets affected, and that shows up as the vision progressively gets worse. And that's one of the reasons why photophobia is such a big issue with Alström, is because the cones, which are very sensitive to light, get affected, and then the proteins which cannot regenerate the stimulus will cause accumulation of all those proteins and a disruption of the phototransduction, causing the photophobia. So how do children present? So initially, often you get children presenting with just wobbly eyes, or what we call as nystagmus, and this unexplained sensitivity to bright light. Those are highlights as to something's affecting the vision. And of course, then gradually you get reduced vision. It can also, not necessarily because of Alström, but you also have a higher tendency for refractive error. Can you hear me? Okay.
Yes, hear you fine. Sorry, it was just somebody coming in. Carry on.
That's fine. So along with the reduced vision, you also have refractive errors, which is basically you can be either long-sighted or short-sighted with astigmatism which requires glasses to help you see better. And gradually over time, you get gradual constriction of the visual fields. So what do we do in these conditions? The main thing is, at this point in time, we cannot undo the process of the disruption of the photoreceptors, of the degeneration of the retina. So we have to maximize the vision that is there. So it's really important to have regular eye checks with your local ophthalmologist. And of course, you also have the additional Alström syndrome clinics that we have, which is the multidisciplinary team with all the other doctors as well as the eye doctor. In addition to this, it's useful to go to the optician yearly, just to have a regular eye check, keep on top of the glasses. And a really useful thing is to get referred into the low vision clinic, because here you have the advantage of sitting down, going through the different magnifiers, the different aids that can be used in order to maximize the vision for reading, as well as having different telescopes for distance. I'll come back to that in a bit. We also have the tinted glasses, which most of you are familiar with, which help with the photophobia, using technology to the maximum, and also at the same time learning Braille, because as time progresses, the vision will get worse, and it's important to have that skill of Braille to take you through your reading in the future. So regular eye checks, so that would involve seeing the eye doctor, seeing the orthoptist in younger children, where the orthoptist helps to check the vision and helps with all the other tests that are required in the clinic, and then to see the optician to update the glasses. It's important to have an overview of the eye testing, because it's not just the Alström, but it's just the general health of the eyes. Often you can get cataracts, or you can have other problems where you have sore red eyes, which can be dealt with. And it's important just to make sure that the eyes stay healthy, so that there are no other problems that are being missed. So in the clinic, what happens? So you're tested, you have your eyes checked, you would have other tests arranged, for instance, electrodiagnostic tests, which look at the stimulus or the responses of the eyes with electrical testing. We're able to then liaise and refer you on to the vision support teacher. You can sort out the site registration and refer you to low vision clinics. And again, it's looking at the general health of the eye and what support can be put into place. So with the optician, the optometrist is what we call as the hospital optician, and they will then check for glasses, make sure that you have the right correction for short-sightedness or long-sightedness, prescribe those glasses. And they're also involved in the low vision clinic, which will look at telescopes. There's some very, very nice little telescopes that you have for long distance. And then you have the different magnifiers for close up. So the very popular one is the dome magnifier and the hedgehog magnifier, which also brings in light so that you can actually see what you're reading. And they're very, very handy to just pop into your pocket and carry around. So dealing with this glare, so this is the main concern that a lot of patients have is the glare, which they actually say the light hurts their eyes. And if you imagine that, you're on the road, you're driving and you're hit by this sudden glare, it can be quite disarming. So again, like I've explained, it's this light sensitivity, excessive light sensitivity, because the photoreceptors, which are the cones, are mainly affected initially, and that causes the sensitivity. And the short wavelengths is what scatter the most, and that can cause more discomfort because of the glare. Now, there's a wide range of tinted glasses to look at, and how do you choose? How do you know what's the right thing, right ones to use? What colors do you use? So it's quite a minefield out there. The important thing is to know is that there are three different types of shaded glasses. So one is the tinted one, which is just a tint and it doesn't change in color. And then you get different colors in these tints. You have the Polaroid lenses, which we'll come to. So that reduces the scatter and gives you more sharpness in your image. And then you have the photochromic or transition lenses, which are very similar to the tinted lenses, except they change the shade depending on the chemical reaction with the light. So the tinted lenses, so the aim of the tinted lenses is to reduce the amount of light getting into the eyes, which is causing the discomfort, and that helps to maximize the vision. So because of the glare, patients often just close their eyes because they can't tolerate it. Whereas once you have the tinted lenses, you can open your eyes a bit better and maximize whatever vision you have. And it also helps with, when you're moving around, you don't bump into things because of the shades. Now, again, it depends on what your level of vision is, but then the aim of these lenses is to maximize whatever vision you have. And what it does is it basically, it absorbs, depending on the color and the amount of tint that you have, it will absorb the unwanted rays of light. It will reflect off the other light, and then you have just the visible light which you want to be transmitted through. Now, when you go to an optician, there are different ways of looking at it. So you might say, oh, I want 100% tint or 90% tint. But what you have to be careful about is knowing the percentage that you have that's mentioned here is the different ways. You have the percentage of tint that you want, or is it the percentage of the visible light that can get through? So that's just what amount of light is being let through. So the very, very dark ones is letting through very little light, 3 to 8%. Whereas if you go for a medium one, it will let 18 to 43% of light come through. So can you say there's a perfect match or a perfect tint to use? No. So I think that's mainly trial and error, seeing what suits that individual, trying out different shades, trying out different colors. We often see that with macular problems, cone problems, for instance, in Alström's as well, that you tend to go more for the red shades. And that's not just red, it's red, orange, purple, all of those wavelengths, those tints is what helps. So it would let through that light, and all the other lights, the lower, the shorter wavelengths are not let through. So there's less damage to the rest of the retina as well. So here you can see how the tinted lenses help. So on your left here is the road that you would see normally, and you can see how the glare affects what you see. On the right, once you have the tints, there's less glare, but there still isn't that much clarity. But at least you're able to open your eyes and look through that tint. The next type of lens that you have is the polarized lenses, where it reduces the amount of scattered light that gets into the eyes. So especially when you're driving and you have a reflection of the road or a shiny, or say maybe the bonnet or some water in front of you. So this scattered light gets absorbed by the Polaroid lens. And then you only get wavelengths which are in one particular direction getting through. And that brings in a lot more clarity. So here you can see that the light entering the eye is much less. However, there's a lot more clarity. You can actually see the road up in front of you and some details of the trees here as well. It's important to remember that Polaroid lenses shouldn't be used in the evenings in the dark, because that cuts out the amount of light getting in, and it can actually make your vision a lot worse. But during the daytime, it's a good idea to have these lenses. So you can see here again, you've got the sharp reflection of that shiny background here, and with the polarized lenses, it's a whole lot clearer as the scattered rays get absorbed. Here's a good example of the photochromic lenses, where these lenses just have a chemical coating to them, and the light hits it and changes the color of that coating with a chemical reaction. And it's quite a slow process. And what's important to remember is that when you go back from a bright area and the glasses have turned dark, when you go into a darker room, and it takes a while for the darkness of the lens to disappear. So you need to give yourself that much time for the lenses to change back to a clearer color. So these are quite useful because you don't need to keep swapping between lenses. But again, it's no more than just a changing tint of the lens. And here again, you can see light tinted, similar to tinted lenses. Again, the light coming into the eye is much less, although you don't get that much clarity. So how do you choose between them? I think the main thing is to try out different glasses, take the time to just give yourself that time to see what suits you. You can possibly combine tinted with with the Polaroid lenses, but make sure that you don't use those at night. Another useful thing to remember is that there's a lot of glare actually from the posterior surface of the lens. So if you have an additional anti-reflective coating on the posterior surface of the lens, that will cut down another 50% of the glare that you get. And it's important that you can choose any sort of tint, but that does not necessarily protect the eyes from the ultraviolet rays. So it's important that you look specifically for about 90 to 100% of ultraviolet ray protection. And what you should look for when you're looking at glasses is to look for this, the standard, the CE or the British standardization mark that you get on the glasses to make sure that there is ultraviolet protection. So just, getting them off the roadside just because they're a tint doesn't necessarily mean that they will protect the eyes. And another thing to remember is you don't really have to pay a lot. You just have to make sure that it's the right protection and the right tint for you. So a few additional tips is having wraparound glasses that go all the way around, because you can still get light seep in from the back and reflect off the posterior surface of the lens, causing a lot of glare. Wearing a cap, perhaps combining the tint with the polarized lens. And before actually going in for anything expensive, just maybe perhaps try on clip-on lenses to see what color and what tint suit you. And another thing is that obviously it's different. You can't read in the dark, so you need some sort of light getting there. So if you just have your having a lamp at a lower level to your eye level, sometimes can help so the glare doesn't hit you directly. So just simple things like that. So light adjustment can make a big difference. So once we've taken care of glasses, low vision aids, all the additional support, I think we now have the advantage of having technology, but there is so much out there. So if you were to Google it, it's just a minefield of what to use. Again, it depends on whether you're an Apple user or an Android user. Apple, obviously, you can go in and ask for extra support. But simple things like, just if you go into the settings, you can look at voiceover, then voice commands. The accessibility setting is quite useful. However, it's a bit tricky because your phone gets locked into that accessibility mode. So you need to make sure that you're able to double tap and scroll through. So, giving yourself time to actually go through this is all very, very helpful. And also it's quite neat to just have your little phone there and doing a lot of the work for you. Google is a very useful set of tools as well. This is a really good website by the American Academy of Ophthalmology, which gives you, it's quite a nice list of all the apps that are available. So I've just sort of, shortened that and just looked at a few of the free apps that you can do in the free settings. One useful thing that you can do, very simple, is just changing the contrast. So as you can see here, instead of a black on white, you can switch the background to having a dark background, which can help and reduce the glare, increasing the font. And then on your desktop, you can change the launcher with something called Big Launcher or Blind Launcher, which just automatically makes all the settings more suitable for low vision. There are various apps. So for toddlers and preschoolers, it's just sort of getting used to, the phone, the tablet, and you have all these little apps which with games on them, so they know how to navigate around quite easily. And as you get into the higher classes, it's then using different artificial technology. You've got the Seeing AI, which can actually, you take a photograph and it can read out handwritten things as well, tells you what's right in front of you, and it helps you to navigate. It tells you what the background is. Well, so you can just sort of move your phone around and know what's around you and your surroundings. Even voice and talking calculators are quite good. Just on the phone, you've got all these free apps available. It's probably a good idea to just play around and see what's suitable. I'm also waiting, and I'm also trying to learn from patients as well. So they come up with some different apps and say, oh, that's a good one to use. So trying to make a list of all of these is quite good. As you go into the higher classes, you can have, the Teams viewer, calculators, and there's also where if you can link it up, you can link your phone up or link the screen up to a bigger screen and read from there. And a few more apps here that you can have a look at, and if you find these useful. The navigation. So I think we did a workshop a few years ago, and then one of the attendees said that, I can't see and I'd like something that would help me to navigate freely. So, and of course, can it be linked to the hearing aid? So now your hearing aid does have the Bluetooth mode, but you just have to make sure that your phone is compatible to this, because this would be amazing. You just carry your phone around, and you've got your hearing aid fitted in, so it works as a hearing aid, and it also works as for your GPS. But again, it's just trying out what app works for you, but this is something quite useful. You've got the Orocam, which I haven't got a picture of here, where you just put your spectacles on, but it pretty much works the same way. So you've got a little camera that helps you to navigate, but your phone can do that as well. So it's something to play around with. So just to recap, the main aim is maximizing your vision, making the most of life, and there's so much support out there. Another important thing I would just want to highlight is the diabetes. So if the sugars have got quite a significant have significant inflammatory property as well, and so getting your diabetes under control, which is difficult but important, would also, in a way, no proof from the eye's point of view yet, apart from diabetic retinopathy, but that might make a difference to the damage that the retina is having because of the Alström. So just making sure that you're as healthy as you can. And these are some resources that you can find. So there's very useful resources. And this starting point, it's just a leaflet with some of the information links on there, where you can just reach out to. Guide Dogs UK is amazing as well. So there are a lot of support and a lot of workshops. So just look into that. And then the most important thing is what research. So there's some research going on there, some ideas in the pipeline. And now that we have the OCT imaging, the eye imaging, which is linked up to artificial intelligence, we can probably look at progressive changes, use that as a biomarker for any of the new prospective drug treatments, the gene therapies, and see what difference that makes. So we're just waiting and optimistically waiting for the day when our retinas can generate again and we can get some vision back. If you do have any questions, please feel free to get in touch. If you have any new resources or any information, I'll be happy to also add that on. So it'd be quite useful. So thank you very much.
Perfect. Thank you very much for that, Archana. Some really interesting ideas in there. And as you rightly say, picking up ideas that come in from, I'm going to use the term patients, people with Alström.
Mm-hmm.
So we have a few questions coming up in the chat box. I know we'd got one from Nicolaus. I don't know if you actually, Nicolaus, would like to unmute yourself and ask Archana the question.
Yeah, sure. Yeah, just because we had these questions when getting the last classes, and we were kind of told that it's not really wise to combine those, at least when you're that highly long-sighted as our daughter Helena is. So there's the question whether you can combine these tinted glasses with the polarization as well.
So with hi Nicholas. So the polarized glasses would not be a good idea for evening time, for darker vision. So it does give you clarity, but it's like two things, one on top of the other. So you can try it, but it may or may not work for her. So it's very individual. But to start off with is the as much tint as she possibly can tolerate, for her to still see clearly. And then also look at an anti-reflective coating on the posterior surface of the lens. Okay. How much tint does she have now?
Yeah, she has kind of the, I don't know how to call it in English. It's Kantenfilter. So it's orange, dark orange.
Okay. Okay.
And
so
it's I think it's supposed to cut off the light at something like 500 nanometers, something like this.
That's right. So it doesn't let through all the shorter wavelengths from 500 and below.
Yeah.
So that's got less. So that's so it takes away all the damaging sort of rays and the scatter. So yeah, coming back to the combination again, there was one other parent that told me that they tried the combination and they found it useful. Okay. So it's very variable as to what helps. But once you get into polarized lenses, the expenses go up as well. So maybe try it as a trial and see whether it helps. But I wouldn't use those if you are out in the dimmer light, because the vision would suddenly gets cut down with the polarized. So it's mainly useful in the daytime.
Okay, perfect. Thank you.
I can see Laura's got a hand up. Laura, do you want to unmute yourself?
Hi, thanks very much. Very interesting. I was wondering, is there currently any databases in relation to children and adults with Alström, and how quickly or how slowly the eyesight deteriorates over a lifetime, as in the eyesight, what degree, or is there any kind of a pattern that all Alström people have with regards to their eyesight, or it is just unique and individual to each person?
So that's a very, very important question, actually, because we are at the moment we are trying to gather all the vision progress. The process of loss of vision at Birmingham Children's, but we need to formally get that published. So that should hopefully be there by next year. But the general pattern that we've seen is that if the younger the child that presents with nystagmus, wobbly eyes, or photophobia, that would indicate that they would lose vision sooner. And what has been found from the research is roughly around, you would say, 50% would have very, very poor eyesight, maybe around the age of 9 to 10. And about 90% usually by the time they're over 12 to 15. Okay. But again, it's very individual. So it depends on when it presented. What's useful now is to again look at the OCT retinal images and see how much damage there is. So we're actually looking at that to individualize it, but we'll probably have a more of an idea by next year once we have all the data collected.
Okay, thank you very much.
Thanks, Laura.
Thank you, Archana. Marina? No, Marina's got a question. Hi, Marina.
Right. Hello, everybody. Thank you so much for that presentation. I wish I'd seen it years ago. It would have been really useful. My daughter's 24, and she lost her sight completely when she was about 18, 17, around that age. She always said that, well, at least when she'd lose her sight, she'd get rid of the photophobia, because she's always been extremely photophobic. And instead, we were surprised to find that the photophobia worsened, and we couldn't quite understand how, or we can't quite understand how she sometimes doesn't know that the light's on in a room, which most of the time she doesn't know whether a light is on or off. But when there's a lot of light outside, the photophobia, she now goes round with welding glasses. She then has a mask on top of the welding glasses and enormous hats. She's got a selection of hats that she uses. In Italy, there are some other patients who've sort of battled with photophobia, having lost their sight. But I wondered, how common is this in Alström?
So, hi, no, thank you. That is such a profound question, because so far the patients I have seen who have lost their vision have actually then got rid of the glasses.
Okay, yeah, that's what we hoped.
and this is something that I haven't heard of this before.
Okay.
The explanation I could possibly think about is because you have the photoreceptor disruption. The ability of the part of the outer segment of the photoreceptor to regenerate when light hits it is reduced. So although the actual seeing capacity has been damaged, maybe there is some remnants there where the photoreceptors are still responding to light in a certain way, not giving the light response, but they are responding with some different sort of signal.
Okay. And could this possibly eventually sort of disappear, or could it continue? Because it's so weird now, especially during COVID, that the whole situation worsened during COVID, and she went around with one mask and another mask and a hat on top. So, but now she still has this other mask, and I mean, we're so used to it we don't even notice it, but people are always sort of really wary. Why has she got a mask on as well? So do you think it might disappear, or?
I think there still may be an element of some sort of vision there, which is why she's appreciating the photophobia.
Okay.
So as there is further disruption or damage to the retina, it may go away.
Okay.
But I would like to hear from you what happens over time.
Okay. If there's any change, then I'll let you know.
Out of interest, if you were to take away all the shades and everything in the dark, how does she respond? Like if you take all the glasses and everything that she's wrapped around?
Okay, so it worries her, obviously, especially, but even if she's in a dark room, and this happened when the transition to blindness sort of was taking place, she complained in the dark of her room of light flashes. And so one of the doctors here tended to think that it was the disintegration of the retina that was causing these, she said it was like light flashes, and she was in the darkness of her room with blinded, and no light on or anything. And yet she had these, it was disturbing. She was crying because it was worrying her so much. So, but then that sort of disappeared, but she remained with the photophobia when she goes outside. But it's the same thing even in a supermarket. And I wondered how psychological this might be. But I've watched her, and it's immediate when there's a change, and she doesn't know that the change is happening. It's only because of the fact that it's worrying her that she notices it, and she says to me, I need to put my mask on. And she starts looking for a mask and her hat and everything. So, and she goes outside onto the balcony before going outside to see whether she's going to need a hat and whether she's going to need the mask, what she needs that day, depending on the light. So I'm not sure if it's completely psychological.
There is something called the Charles Bonnet syndrome, where when you've lost your vision, you're still able to, or your brain still appreciates shapes and images and flashing lights.
Okay.
So when you say that she could see things in the dark, that could be part of that.
Yeah, she won't avoid an obstacle though. She doesn't see an obstacle. She only picks up on the light. So yeah.
So whether it's, yeah, so the brain still can appreciate certain things, and whether that's what she is interpreting as being seen. But the fact that when she's out in the balcony and then she's uncomfortable, without, she needs to wear these shades. Whether there's a remnant of, the functionality of the receptors to a certain extent in a different way, in a damaged way.
Right. Yeah, no, I'm getting it now. I get it now. It's and in fact that makes sense.
But that's something again which I think I will, look into as we go through our other patients as well.
Thank you.
Thank you for sharing.
Thanks very much for the answers.
Thank you for that, Marina. I've got another question coming up in the chat box. I don't know if let me just see. Is it Charlene? Do you want to ask the question, or would you like me to ask the question for you?
Yeah. Hello. I will ask this question. It's my sister's account, so don't be surprised. I just want to ask if there is any research which would lead to operate on the eyes of to any kind, to maybe work on the macula and on the proteins to get the proteins reproducing themselves again or something like that. Thank you.
Okay. Thank you. I really wish there was a quick fix, like an operation, but unfortunately at this point there isn't. However, there is research going on, and in Moorfields Hospital, they have, they've managed to do some research where they can regenerate some of the proteins, and they're looking into certain drugs that might translate into creating new proteins, full-length proteins, which are required for this for the phototransduction. So there's still a while, but we still don't have any treatment at this stage. But hopefully within a few years there may be something more.
Okay. Thank you.
Does that answer your question?
Yes, we've got a thank you in the chat box. I mean, we would remind people there's some stem cell research going on at Gosh as well. And there's a link on our website to some of that work. We did some of the folk came on and presented at our last conference, so we can kind of direct you to that information too. Okay. Have we got any? Oh, yes. Okay. So we've also got a note here from my colleague Sarah Oliver saying Sense and the RNIB both have good information booklet on Charles Bonnet syndrome. So that's really helpful. And we'll post that up afterwards, particularly for Marina, but might help other people too. Okay, so does anybody else have any questions? I have a few questions if nobody else has, if I may. Going back a step, Archana, you talked a little bit about some of our folk having cataracts, and I know some of our adults have had some successful operation in cataract removal. I suppose the thing I'm interested in is, one, do you see cataracts in, the under 18 group? And two, how would that child know, or how would a parent know? How would they kind of recognize it, given a lot of the things around cataracts are around glare and things? Does that make sense?
Yes. So you do get cataracts right from birth. So that's a different type of cataract. And that's the reason why we have the regular eye checks, is to make sure that we identify the cataracts. Now, with the reduced vision, the child may not necessarily know that they have a cataract, and that might be impacting the vision as well. And do we operate on it? So when we talk about adult cataracts, that's, it's a routine operation. It's basically, if you imagine your television screen, and you've got a curtain in front, a net curtain in front of it, like a cataract. So we can just take the cataract off and then watch television. Whereas if the screen is not working, is it worth doing the cataract operation? So even if we take the curtain off or the cataract off, if the actual screen is not working, is it worth the effort of an operation? Then a cataract in a child can be quite traumatic, although it's done right from birth. And, you have to make sure that you have drops in every hour for the first few days, sometimes even up to a few weeks. And then you carry on for 3 or 4 times a day. So you've got the trauma of having the drops in to keep the inflammation down. But if the vision is, if you think the cataract is impacting, if it's a significant misting of the eye, of the lens of the eye, then you could go ahead for a cataract operation. But is it worth the risk? Is it likely to cause further damage to whatever retinal, functionality there is? So that's a balance we need to look at for each child, or even as an adult. But I think in Alström's, at a much older age, your vision would be you would have lost a significant amount of your vision. And then in addition to that, doing an operation may not be of much benefit. So it's a tricky one. To put it in perspective, I would say if it's not a significant cataract, just leave it alone. Often there's just a small central cataract, which really isn't doing much. But the vision's already so poor that it's not going to do any additional damage. And it's just reducing the vision further. So maximize it as much as possible. Maximize the vision would be the key take-home point.
Okay. Thank you very much for that. Just to say, just in the chat box, Marina's just posted that there's a study in Italy on the liquid retina, Novadido. Well, I'm not going to pretend to try and pronounce that in Italian, but trials have been some trials have been completed, and this year they start doing some tests on patients. So it'd be great if Marina, who leads the Italian Association for Alström folk, would keep us up to date on that. That'd be really helpful. Thank you, Marina.
Fantastic.
Okay, so we have another question. I don't know. Philip, would you like to answer that? Answer it. Would you like to ask that yourself? Are you with us, Philip?
Yes, I'm here. Sorry, I'm out walking the dog, Anne, but I am here. Yes, thank you.
Okay.
I wanted to ask, just because you obviously mentioned about cataracts and adult vision loss. I just wondered if there was any, is there any certainty around sight loss in Alström? And or that might be an Alström specific question, and it may not be pertinent to the kind lady who's leading the talk. It's just something that had just occurred.
Okay, so the question, Archana, that Philip posted up is, are there any Alström adults who have not experienced complete vision loss as adults? And I'll just share our experience. We know of one in America. We know one adult with Alström who hasn't lost his sight. You may know more than I, Archana.
So I only do the children's clinic, and all the adults then get transferred over to Queen Elizabeth in Birmingham. So I haven't been able to follow them up there, but that's another good point to look at, is to see if we can, coordinate and follow children into adulthood and see what happens. And could I ask this adult that you have in America, what sort of vision does that person have? You said
it's a conversation I had a couple of years ago when I was at conference, and we just identified that there was one adult male I think he was in his 20s, mid-20s by then, and he'd still got most of his sight. What most of his sight was, I'm not sure, so I couldn't give you the kind of the technical details, but it was discussed because he was so unusual.
Right. So what would be interesting is to know when the vision, when Alström was identified, what the symptoms were, and if we had any OCT images, then to look at that, so we can, identify that cohort of, changes.
Well, there's a conference that maybe some of the folk who are online are going to next week. There's a Alström Syndrome International Conference on Wednesday, Thursday, Friday in the States. I don't know if anybody here is going to that, but that's certainly a question we can follow up with some of our colleagues in America. I'll just make a note to do that because sight. Plus, as we're going through this, obviously we're going to put all the links that you've shared and other links that will go onto the website afterwards, just kind of to reassure everybody about that. Okay, another question from Nikolaus. Do you want to unmute yourself? Oh, okay. Yeah, Nikolaus, do you want to?
Yeah, I can unmute myself. Yeah, I was just writing that we in Germany we do have a 30-year-old woman who at least hasn't lost the vision completely. I don't know the percentage of sight she still has, but at least she didn't lose the vision completely.
Wonderful. Well, so it'd be nice to see what how she presented as well, and what her OCT retinal images show, and then whether we can link that up with the research.
Mm-hmm. Yeah.
Yeah. I mean, if you're interested, we can make the contact for sure.
That'll be very helpful. So we're almost using the OCT like a biomarker to see whether what changes there are and what phenotype. Although we know it's the same Alström gene, are there any specific changes to that gene?
Yeah.
Okay. Thank you.
Okay. So are there any other questions for Archana from anybody? I'll just give it a few minutes just in case people want to put anything in the chat box. I'm just running through the chat box. I think Archana's certainly answered everything. We've got some very useful links in there. So big thank you for that.
Could I ask a question?
Yes, of course.
So just one out of interest is is anybody using assistive technology, or are there any further information? How useful really is it for the Alström, if I say patients or parents using technology with children? Or do you need more information on that?
Sorry, could I ask, you mean things like the ORCAM, or I think all Alström patients nowadays depend on the computer and
yes.
all sorts of assistive technology, but it depends on exactly what you mean.
So
there are also
so the ORCAM is fine, but like the phone and using different apps, and is there enough information that you're getting to support patients with Alström to use it, or are they able to use it?
Well, I think the young people all use telephones with voiceover and WhatsApp, and unfortunately in Italy, one of the things which isn't encouraged enough is the use of Braille, whereas any assistive technology is extremely encouraged. But in the study of languages and other subjects as well, Braille really is important. And so I feel that one of the points that something that is really lacking in Italy is the encouragement of the study of Braille, basically because there aren't enough people to teach Braille. or not enough people who know about Braille. And so the people who should be doing this just say, oh, it's just too difficult. And instead, it's out of fashion. There are more modern things that one can use nowadays. Anyhow, my daughter uses all sorts of assistive technology in that sense. And I don't even know how it works. She knows how to use it and how it works. And I see very often people are curious. They say, how can a blind person be using a phone? Because they don't realize, how they can navigate a phone or a computer. And even she has a more sophisticated walking stick, a white cane, but she actually prefers just the standard white cane, which is always used. So yeah, I imagine that it's the case everywhere. And we have centers for the blind, but usually the information is transversal. It doesn't come from centers for the blind, the Union for the Blind, etc. I think they learn from each other. People who are young teenagers, they get together in groups and they pass on information. So I'm not sure if that helped as an answer.
It does. I mean, it would be nice if your daughter could also share what app she has found useful, because there's a minefield of technology and apps, and it's just you don't know which one you use. So if we perhaps had just a collection of what people are using in the Alström Society.
Sure. Ours might be conditioned by the fact that we're living in Italy and she's basically Italian. So I was born in South Africa, so I speak English too, but we're living in Italy. And so people who speak English really have a lot more at hand than people who are Italian. I'm not sure about other languages in other countries, but there's a lot more available for an English-speaking person. She doesn't use an Apple phone. She prefers Samsung, so I know she's sort of atypical there. But there are a group of Italian young people who do use Samsung as well, and they have all sorts of apps that they use. She has no difficulty in managing the phone at all. So as I see most young people, she's far better than I am. So
that's big.
Thank you for that, Marina. We've also got a couple of hands up, plus a couple of things coming up in the chat box. Certainly one from one of our adults with Alström, who says one good resource is Accessible Media Inc. I know he's in Canada, and it has a show called Double Tap, which talks a lot about technology, plus Netflix. Philip mentioned Netflix has the voiceover features, which is really good. And Nicholas says his daughter is in class 2, uses an iPad in school for all the paperwork with amplification inverted colors, no special apps at the moment. So we'll keep collecting those because they're really useful. Particularly as some of this global webinar has got people from all over the world, and there are different things elsewhere. But a couple of questions, couple of people with their hands up. If I go over to Laura first.
Hi, over in Ireland here, with regards to technology, my daughter's only turning 6 now. They start them off in school, and she actually does what we call dual learning. So because she still has eyesight, she's learning like the other kids, but she also has a teacher comes in every 2 weeks to start Braille with her. But because her eyesight isn't good, we use technology. She has a magnifying system that will magnify her books, but it'll also actually read off a whiteboard too and put it in front of her. So the rest of the kids use whiteboards instead of blackboards when we were children, and that's available to them. We actually, last Saturday, we had a conference here in Ireland it's a parent support group called FAKE, which means See in Gaelic. And there's a company called, Vision Technology. and they went through all the different types of technology the children is available to children in their schools, and it's all run through the National Society for the Blind. So as a parent, all I have to do is sign forms to get a grant, and the government will pay for the technology to be used in schools for the children. So we try and start them over here with technology as soon as they're born, and we know there's bad eyesight. You get them onto a touch screen just to get used to being able to scroll and move objects around the screens and work that way. At home here, she would only have a tablet. That's all she has at the minute with basics, so she knows how to scroll up and scroll down. But as they go along in school, they actually teach them the technology as well as the Braille. So they do learn, plus they learn Irish, which is our national language, and they all speak English here as well. So I think it's quite advanced for a small country, and Sheila currently is the only child in the country with Alström that I know of. There is adults, and the adults currently, one of the adults is 18 and he's currently studying law and history in a university here, and his sister, who's also Alström, she's actually doing speech therapy in university as well. Recently, the government also, because of this family group, they got the government to turn over what our general, we do and leaving cert, we call it. I think it's equivalent to A levels in England. The paperwork for, if you had to have it in large, would be 52 pages for one exam. To try and read through that, you've only a 3-hour stint. We now have that paperwork on technology. The government, there was a turnover thanks to this group. So it's actually on computer, on PDF screens, so you can zoom in and read it that way. So that's helped with kids for doing exams. So that's going to be introduced, and we're hoping to turn them on technology for all aspects of exams within the country. So thanks to one of the mothers who's both kids of Alström, she did that for every other parent in the country, got that changeover done this year. So we're quite good with our technology here.
Fantastic.
It's slow, but we get there.
Brilliant. Yeah. Brilliant. Thank you for that, Laura. And I know that will warm the cockles of Marina's heart to know that she's learning Braille too. She's a great advocate of that.
Any parents, the fake group is on Facebook, FEACH it's called.
Lovely.
It's a brilliant support, particularly if your children are starting school. It's a charity organisation. Well, they're going for charity status. It's parents that have set it up, but they produce booklets for parents for the change from preschool to school, from primary school here to secondary school, and what you should be looking for and advocating for your child when they're going to school with visual impairment. So that's all available, and it's a brilliant organisation to give you help. They were being brilliant to me for school and that, for Sheila.
Brilliant.
Okay.
Yeah, brilliant. Thank you, Laura. We'll share that link as well if we may.
Yeah, no problem.
And Archana's just mentioned actually that there's a Braille iPad, a Braille tablet iPad. I don't know if people have got that, and it sounds to me as if there's a need for us to put together something that addresses the technology, or certainly a webinar around a technology in particular, to see what people are using and finding successful. Sarah, you have a question? You've got your hand up.
I was just going to say, from sort of the Alström in the UK, I think in school, people do learn Braille, and it is used in school and in higher education. But I think in the main, and I know I'm talking for other people, I think people tend to go on more to using technology, laptops, touch typing, voiceover technology, although they do have that opportunity to learn Braille at school. I don't think adults necessarily use that a great deal further on. You know, they might ask for correspondence by email, or they'll use things like talking books, or you get lots of apps now for audio books, things like that. So although it is a skill that's still learned, I don't think it's necessarily widely used by the adult population, really. Going back to the tablet, Braille tablet, there's a humanware tablet that has a Braille display on it, but I think they are about £5,000. They're very expensive.
Ouch. That is expensive, isn't it?
Yeah.
Okay. Well, thank you for that, Sarah. And I think we're certainly getting some other suggestions in the chat box, and we can put all of those together. It is going to be dependent where you live in the world, obviously. But I think there's perhaps some simple and hopefully some cheaper resources that will work for both under 18s and over 18s. I think our experience in the UK is generally most adults are using their phones for everything, and kind of everything really. Yeah. Okay, so I presume you want to put your hand down, Sarah. Yeah. So just before we round off, are there any more questions from anybody? Oh yeah, great. Just a note from Philip. Victor, for those of you in the UK, Victor are offering coding equipment for visual impairment, and he's still waiting for one too, but that's quite UK specific. But again, another link that we can share with people. So thank you very much for that, Philip. So just before I round off, are there any more questions from anybody? I don't have anything in the chat box. I would just like to thank Marina for her input, and possibly mentioning that her daughter is a keen skateboarder. We still have the pictures of her skateboarding. Okay, so I'll just round up and say a huge thank you to Archana for joining us tonight and sharing her views, her advice, her experience. Some very useful tips in there that we will put all together. We will post those onto the website in a few weeks, but meantime, if you've anything else you think's helpful, please email my colleague Catherine. We'll put a top tips together, so if you want to input into that in terms of links, and links it specifically maybe in your own country and where you are, that might be very helpful to others there. So just to kind of round up and say very big thank you to everybody who's joined us. It sounds as though we need to put the topic into a next webinar, which is all around technology and its use and how people are using it. And, you know, those very kind of practical, pragmatic approaches to using technology. So once more, a very big thank you from all of us, Archana, for joining us. Really, really appreciate it. I know you're super busy, and just by your picture, I can see you still at work, still in the hospital. So, you know, thank you.
Thank you for the opportunity. It's always lovely to share and, you know, get information as well. No, thank you.
Perfect. So on behalf of all of us, thank you very much, and look forward to seeing all of you next time. End of October is going to be our next webinar. We're trying to do them monthly on a Thursday. Again, always open to any topics that you'd like to see covered, or those of you who would like to present, we're always open to any opportunities for anybody. Thank you very much, and a very good evening. We'll be posting information soon. Thank you. See you soon.
Thank you, everyone. Bye-bye.